Now we'll quickly try to move to the next lecture, which this lecture is more of like listing or just calling out some things, right? So here we're trying to look at how cancer of the cervix can spread. What are the different ways through which the cancer of the cervix can spread? Okay, so of course the type of cancer of the cervix that can spread is the type 3 and type 4 mainly. Okay, type 3 spread into the lymph nodes and kidneys, while type 4 is now going to lungs, bones, all of that. So it can spread through distinct pathways, okay, because it moves from a disease condition that is just in one place, which you call localized, to a disease condition that is spreading to many places, which we call advanced. Okay, so most of spread you can have local extension. So this one is just spreading within structures around it. So you can spread to the vagina, spread to the uterus, spread to the parametrium, spread to the pelvic walls, spread to the bladder, spread to the rectum. Okay, so this one is just within the structures around it. Okay, so what is spreading to. Lymphatic spread is when the cancer cells will now travel through the lymphatic vessels, like pelvic lymph nodes, para-aortic lymph nodes. Okay, so basically it's spreading to the lymph nodes, it's making progress. Hematogenous spread is via the bloodstream now. It's less common unless it is now late stage. Okay, so it can move through the bloodstream and affect the lungs and liver and bones. Okay, of course blood goes everywhere, so once it gets into the blood it can now go, okay, to these distant sites. So transcoelomic spread is very rare but involves spread across peritoneal surfaces. Okay, so clinical implication of spread is, of course, it will now go to all those organs, all those tissues, and cause issues in them. That's just the implications, right? So if you want to now know the implications, just take this tissue, the complications. Lungs, of course, you'll be knowing that there is difficulties in breathing. Okay, bones, of course, you know that maybe osteomyelitis, weak bones. Do you understand all those kind of things? Okay, and it also increases the intensity of treatment, which the treatment have their side effects on the patients too.